Hello everyone, Dr. Mark here with you again, and today I want to talk about 4 things you should do if your dog is vomiting. I do not recommend any of the over-the-counter medications be used to stop vomiting, but if you follow these steps then the vast majority of dogs will stop vomiting even without medications. If your dog only vomits once and then stops, don't worry. Sometimes, he or she may have eaten too fast, or perhaps they might have an upset tummy after eating something strange while dumpster diving, or otherwise rooting around in weird foods. If your dog throws up several times, however, and looks like they might continue to do so, you need to take action. If your dog is vomiting blood, do not follow these steps and seek a veterinarian immediately. If a dog vomits more than once but is not in distress, here are some steps to follow. The first step is to fast your dog. Take away your dog's food so that their stomach can rest. Though there is some controversy about how long you can safely do this, a healthy dog can easily go without food for 24 hours. If you feel better about taking your dog to the vet right away, that is certainly okay. If you have any doubts, or you have a dog prone to bloat, this step should be skipped and you should go to the veterinarian immediately. Puppies, especially if never vaccinated, should also be taken in immediately instead of fasting. The exam or lab work might an infection like parvovirus that need to be treated immediately. The next step is to limit your dog's drinking water. Make sure your dog is not drinking and filling up on water. If they are drinking, they are not fasting. This is why you are only given ice instead of water at the hospital. Drinking a lot of water on an upset stomach is going to provoke vomiting. If your dog is a senior, very tiny, or has other health problems, keeping them without water is not a good idea. An old dog should be taken to the vet as soon as they start vomiting. The third step is that if vomiting stops after a simple fast, they can once again be given water. You can do this by giving the dog ice cubes to lick and then small amounts of water if the dog holds them down with no problems. You should also offer bland food. White rice with boiled hamburger or chicken breast is a good diet to use when it is time to resume feeding. A 75% rice to 25% low-fat meat, boiled low-fat ground beef or chicken breast, is a good ratio to follow. If they are holding everything down, you should feed the dog small meals 4 or 5 times a day for a few days and then slowly switch back to regular food. The fourth and final step is that if your dog continues to vomit, despite the fast, you will need to take them to be seen by your vet. If your dog vomits blood before or after the fast, continues to vomit even on an empty stomach, is experiencing other symptoms like lethargy, or starts vomiting again as soon as you begin feeding them, you need to take them to your vet for a physical exam and lab work. Do this as soon as possible, since some problems, like bloat, need to be taken care of immediately. If it is not treated immediately, the dog will die. Take some of the dog's vomit, in a small plastic bag, with you if possible, and be sure to tell the vet if you have seen any blood or black color in the vomit. There are many simple reasons that your dog might vomit. These are some of the less serious conditions that may cause your dog to vomit. In these scenarios, your dog will usually just vomit once and then stop vomiting as soon as its stomach calms down. One of the most common is an upset stomach, gastritis, from eating garbage or spoiled food. Eating too fast can also cause vomiting in some dogs. Eating toxic grass or plants. Some dogs will eat grass when they have a mild gastritis, which may provoke vomiting. Exercising after eating can cause vomiting in some dogs. If your dog is gagging like he wants to vomit but nothing is coming out, that can be a cause of bloat. Car sickness is usually pretty easy to identify. Just resting the stomach and letting the dog rest is enough in most cases. Sudden diet change can cause problems in some dogs, as can postoperative nausea. If your dog just vomits once but otherwise appears healthy, it's likely they're okay and just had an upset tummy. If your dog is still vomiting, even after not eating or drinking anything, it's a sign that something more serious may be happening, and you should seek veterinary attention immediately. This is especially true if your dog is lethargic, refuses food, or has a tender abdomen. Some of the things that can cause your dog to continue vomiting even with an empty stomach include poisoning. Some poisons will cause vomiting. They need to be treated right away. Bloat is a serious issue. If your large dog's stomach is swollen and filled with gas, it will become extremely painful. The dog will try to vomit, but nothing will come out. If your dog is trying to vomit but nothing is coming out, go to the vet instead of fasting your dog. Stomach ulcers or cancer can also cause vomiting on an empty stomach. Your dog might be vomiting up fresh blood, red, or digested blood, black. If you notice coffee grounds in your dog's vomit, that is a sign that she is bleeding a lot. You need to go to the vet to find out why. Blocked intestine. Your dog can have a blockage from eating something, like a rubber ball, or might even be blocked by a piece of his own intestine, intussusception. Other symptoms of intestinal blockage include difficulty defecating and abdominal pain. Your vet will have to take X-rays to find out if this is what's happening. Infection. Parvovirus is the most common. Its symptoms also include fever and diarrhea. There are also several other types of infection that will cause a dog to vomit. If the dog continues to vomit and you do not get help, it will become even sicker and could possibly die. Neurological or psychological issues. Some neurological issues can cause your dog to vomit, such as a brain tumor, meningitis, middle ear problem, anxiety, or fear. Other warning signs include stumbling or lack of balance, head shaking, and vision problems. Before I get into some of the things that might show up on the exam for vomiting, I want to ask you a favor. If you find this information on this video helpful, please give it a like. Despite the fact that this information can help a lot of people, if it does not get enough likes, the YouTube algorithm will decide that it is not useful and will not send it to dog owners who need it. Also, please take a minute and subscribe to my page if you want to learn more about dogs. You will find plenty of videos on choosing dogs, and I will post more videos on saving money on heartworm prevention, some home tips to take care of skin problems, and how to make affordable homemade dog food. If you have any ideas for videos you need to help your dog, just drop a comment and I will get on it as soon as possible. What kinds of problems might show up on a physical exam at the vet? Pancreatitis. Your dog is especially at risk for this if it is obese or at least has a history of eating fatty garbage. Symptoms, aside from vomiting, include a painful belly and loss of appetite. Besides the blood work, your vet will recommend X-rays to check the pancreas. To reduce the risk of pancreatitis, owners of obese dogs should start their pets on a weight loss program. Kidney disease. If your dog ate poison or is old and suffering from kidney failure, they will start vomiting because the toxins in their body are making them sick. Your vet can find this out with a lab test. Liver failure. There will probably be a lot of signs besides vomiting. Your dog's gums will be pale, and then yellow. Its belly might be swollen, and they might even have seizures. If you notice these symptoms, as well as the vomiting, you need to take your dog to the vet for an exam and lab work. Diabetes. Your dog can develop diabetes for several reasons, and one of them is pancreatitis that happens over and over, destroying the pancreas over time. Their pancreas is no longer able to produce insulin, and they can develop a condition called ketoacidosis and will start vomiting as a result. Other symptoms of diabetes include extreme thirst, frequent urination, and sweet breath. Ruptured bladder. Sometimes a dog can have a ruptured bladder after being hit by a car. They would not start vomiting until a few days later when the toxins get into the bloodstream. The vet will be able to tell this from the exam, blood work, and X-rays. Pyometra. This is an infection of the uterus that your dog can get if she's a female that isn't spayed. If she has it, she will drink a lot of water, have discharge from her vagina, and eventually start vomiting. The vet will notice abnormalities on the exam and the blood work. This is a life-threatening condition, so she will need surgery. There are a lot of things to think about if your dog is vomiting, and there are many other abnormalities that you might not even notice but that your vet would pick up during a physical exam. If you are worried about your dog being too old, weak, or depressed, or especially if she is vomiting after you stop feeding her, take her in right away. Vomiting may be nothing to worry about, or it may be a sign of something serious. It is your job to find out why. Thank you for watching. I am a veterinarian with over 40 years of experience with dogs and cats, exotics, poultry, and livestock of many types. If the information in this video was helpful, please give it a like so that it can reach more viewers, and if you know any other dog families that need to know this information, please share it. Be sure to subscribe too if you want more information on dog health issues. If you prefer to read this information, you can find my articles at pethelpful.com. If you have any health problems with your dog and need some information, please contact me at my Ask a Vet column at pethelpful.com or askavet@yourpetsathome.com.